Condoms are one of the world's most widely used forms of contraception and protection against sexually transmitted infections, commonly known as STIs. Despite their simple design, condoms play a crucial role in sexual health, offering a barrier that helps individuals take control of their reproductive choices and safeguard their well-being. Understanding exactly how condoms work, why they are effective, and how to use them correctly can empower people to make informed, responsible decisions about their sexual lives. At their core, condoms are thin sheaths typically made from latex, polyurethane, or polyisoprene. They are designed to fit snugly over the penis, or, in the case of internal condoms, inside the vagina or anus. Their primary function is to create a physical barrier that prevents sperm from entering the vagina, thereby reducing the risk of pregnancy. At the same time, condoms block the exchange of bodily fluids, including semen, vaginal fluids, and blood, which are common vectors for the transmission of STIs such as HIV, gonorrhea, and chlamydia. Let's take a closer look at how condoms work. When used during intercourse, a condom collects semen released during ejaculation. By containing the semen, the condom prevents sperm from coming into contact with the partner's reproductive organs. This drastically lowers the chance of fertilization. Additionally, because condoms are impermeable to viruses and bacteria when used properly, they are highly effective at reducing the risk of transmitting infections. This dual function makes them unique in the world of contraception. Effectiveness is a common question when it comes to condoms. When used perfectly, meaning every time, and, according to the instructions, male condoms are about 98% effective at preventing pregnancy. However, with typical use, which accounts for human error such as improper application or occasional forgetting, their effectiveness drops to around 85%. This means that out of 100 couples using condoms as their only form of contraception for a year, about 15 may experience an unintended pregnancy. To maximize protection, it is essential to use condoms consistently and correctly. Now, let's talk about the different types of condoms available. The most common are external condoms, which are worn over the penis. These are usually made from latex, but for individuals with latex allergies, options made from polyurethane or polyisoprene are widely available and offer similar levels of protection. Internal condoms, often referred to as female condoms, are made from nitrile and are worn inside the vagina. These provide an alternative for people who cannot use external condoms or prefer more control over their protection. Using a condom correctly is straightforward, but it's important to pay attention to each step to ensure maximum effectiveness. First, always check the expiration date on the condom package. Using an expired condom increases the risk of breakage. Next, inspect the package for any damage such as tears or holes, and feel for an air bubble inside the sealed wrapper, which indicates that the package is still airtight. When opening the condom, be gentle. Use your fingers rather than teeth or sharp objects, which can accidentally tear the condom. Once opened, make sure the condom is right side out. The rolled rim should be on the outside, so it can be easily unrolled down the length of the penis. Pinch the tip of the condom to leave a small reservoir, which collects semen and reduces the risk of the condom breaking. While pinching the tip, place the condom on the head of the erect penis and unroll it all the way to the base. If using a lubricant, make sure it is compatible with the condom material. Water-based or silicone-based lubricants are safe for use with latex condoms. Oil-based lubricants, such as lotion or petroleum jelly, can weaken latex and increase the risk of breakage, so they should be avoided unless you are using condoms made from non-latex materials that are deemed safe with oils. During intercourse, if you feel the condom slipping or breaking, stop immediately and replace it with a new one. After ejaculation and before the penis becomes soft, hold the base of the condom and carefully withdraw from your partner. This prevents the condom from slipping off and spilling semen. Remove the condom away from your partner's body. Tie a knot at the open end to prevent leakage, wrap it in tissue or toilet paper, and dispose of it in the trash. Never flush condoms down the toilet, as they can cause plumbing problems and environmental harm. It's important to remember that condoms are designed for single use only. Never reuse a condom, as this greatly increases the risk of breakage and reduces effectiveness. Also, do not use 2 condoms at once, either 2 external condoms or an external and internal condom together. Using more than one can cause friction between them, making them more likely to break. Condoms are widely available and affordable, and in many places, they are offered for free at clinics and community centers. They come in a variety of sizes, textures, and even flavors, allowing individuals to find the best fit and feel for their needs and preferences. Finding the right size is important for comfort and effectiveness. A condom that is too tight may break, while one that is too loose may slip off. Beyond their physical function, condoms also play a role in fostering communication and trust between partners. Discussing condom use can encourage open conversations about sexual health, boundaries, and consent. This can enhance intimacy and help both partners feel secure and respected. While condoms are highly effective at preventing many STIs, it's important to note that they do not offer complete protection against infections that can be transmitted through skin-to-skin contact, such as herpes or human papillomavirus, HPV. However, they still significantly reduce the risk and are an essential part of safer sex practices. In summary, condoms are a simple yet powerful tool for preventing both unintended pregnancies and sexually transmitted infections. Their effectiveness depends on consistent and correct use, and understanding the basics of how to choose, use, and dispose of condoms is key to maximizing their benefits. By making condoms a regular part of sexual activity, individuals can take charge of their health, protect themselves and their partners, and enjoy greater peace of mind. Whether as a primary method of contraception or as an added layer of protection alongside other methods, condoms remain an essential component of a responsible and healthy sexual lifestyle.